Hi guys, welcome to Lindsay's Linked. Today in this video, me and my friends coming forward to salute all the healthcare workers around the world for their hard work, dedication towards caring COVID-19 patients or pandemic. Healthcare workers, especially those working in intensive care units and also in various other health departments. And I would like to say that the staff or the healthcare workers working in the intensive care units are the real heroes or real soldiers today. Every healthcare members is on their feet trying to do their part and contributing towards serving lives and making people feel better and stronger each day. We doesn't know what's going to happen tomorrow. Things will continue to be tough, but as healthcare workers around the world have already proven that they are not going to sit back and relax, and also they need help, they need a backup force, and they need more equipments for the better functioning of the healthcare workers. Let us pray to God that they get all the equipments, and whatever they want they may get it. They also have to ensure that well-being of their healthcare other members, healthcare workers, both physical health and also the emotional state. And I would like to, or I salute all the healthcare soldiers out there for staying firm and strong. We doesn't know what new day brings and trying their best to satisfy all the patients, families, staff, and the media. So, and thank you. I thank you all the healthcare workers for their dedication and the hard work. And let us hear what my friends they would like to say. Thank you.
Hi everyone, my name is CG. I'm a registered nurse working in Holy Cross Silver Spring Hospital. It's in the United States of America. COVID-19 was a pandemic that affected the whole world's life and freedom, and it created a lot of insecurity and uncertainty to the daily life of the people. As a healthcare worker, given me an opportunity to give a hope and spread light in the midst of the despair. I take this opportunity to thank all my healthcare workers around the clock to make this possible, to make this recovery possible. As everyone knows, we all work in the midst of the fear, but we came through this long. Thank you everyone who worked in this pandemic, and we are heroes. Thank you.
Hello everyone, I am Dr. Rajendran, professor and psychologist from Harvard University. Shortly, we are in a major challenge towards this COVID-19 pandemic. Most of the people are experiencing the psychological threat like mood swings, depressed mood, catastrophe, sleep disturbances, stress. Of course, we do also experiencing certain amount of stress, since we have to spend a long time, at least 30 to 45 minutes with every client while maintaining safety layers. Our most of the clients, they reports about their difficulties, complaints, and simply follow their thoughts, whatever that projects in their mind. Instead of accepting the fact to change their thoughts, they are asking assurance and reassurance of not infected. This is one of the very major challenges that we are facing presently in our practice. I would like to share one thing with you all. Whenever there is a major change in our life, it will be a big challenge for us. We have to face it rather preoccupied with unwanted irrational thoughts. Of course, the government, physicians, healthcare workers, they are working to prevent this pandemic in an excellent way. Let us follow and hope that we will come out of these situations very soon. Thank you all. Have a nice time and enjoy with your family.
Hi everyone, I'm Dr. Minimal Kejoni, reader at Pushpagiri College of Dental Science and endodontist at Crown and Roots Multi-Speciality Dental Clinic. So we are all going through a very difficult stage of our life. Our dental fraternity is also facing a lot of challenges in this COVID era. So dentistry, as you all know, it's a very risky profession in these times because we mainly deal with oral cavity, teeth and patient saliva and all. So it is little very risky to do the treatment right now. and so our me and my colleagues are facing a lot of stresses and tensions as far as this infection control is concerned, personal protection is concerned, and also of course the financial and the economical aspects. And above all this, I take this opportunity to thank our frontline warriors in this COVID era, mainly our doctors, nurses, and all other staff who work from day and night to protect us from the clutches of this deadly virus. So I salute them and I respect them. And also I'm pretty sure that we'll be able to come out of this bad times. We'll be able to stay strong, and so I request all of you to be alert and wear mask, keep social distancing, and sure we'll be able to break this chain. Thank you everyone.
Welcome, dear viewers. I, Mrs. Mary Verghese, the nurse educator of Sagar Hospitals, am here to discuss about the advice that I need to give to the nurses and the health care workers who have taken care of the COVID-19 patients. COVID has thrown our lives out of gear, not denying the fact that the pandemic and lockdown has inflicted psychological trauma to all humans on this earth. I appreciate the grit of the healthcare workers, that is doctors, nurses, paramedics, who are facing all odds of this pandemic. Tireless efforts from the healthcare workers in times of distress is often overlooked. Just a piece of advice to all healthcare workers: to follow meticulous hand hygiene, respiratory hygiene and cough etiquette to be maintained. Don appropriate PPE wherever required. Avoid touching eyes, nose and mouth. Clean and disinfect frequently touched areas. Social distancing to be maintained at all times. Eat nutritious food, that is, it consists of balanced diet. Remain hydrated, that is, drink a lot of water, green tea, lemon juice, etc. Stay positive. Divert the mind by listening to music, reading your favorite books.
Friends, myself, Akil Rajasvi. I work as a staff nurse in Government TD Medical College, Alappuzha. So, in this COVID-19 pandemic period, it is a public health emergency which is faced by our nation and all worldwide. So, it is important to be vigilant, not to be panic. We need to have a war with the virus. So, we need to have a significant role as a healthcare provider or as a family member. So, it is important that our basic hygienic practices are important during this period, and we need to follow the instruction of government or the stakeholders. And the important thing is that as a healthcare providers, we are so prone to have infection other than the public. So in this period, we need to follow the protocols which is implemented in our hospital, and to follow strict hand hygiene practices and to wear personal protective equipment. So thank you. Stay home, stay safe, and break the chain.